Good morning, Dr. PK. Happy Monday. Today, the part of my video series, your question and my answer, I'm going to discuss about overlap syndrome. Overlap syndrome is features of lupus and Sjögren syndrome when they resemble to some extent. And one of the follower journey with lupus asked me this question. Your patience and clear explanation has been very helpful for understanding the lab tests, etc. If you'd allow me to ask another follow-up question, are there any overlaps in terms of treatment, lab test, and monitoring if one has lupus and associated with Sjögren's disease? Yes, there is a significant overlap between lupus and Sjögren syndrome, especially in treatment approach, labs, and monitoring. I'm going to break this down clearly and clinically. Why do they overlap? Both are autoimmune connective tissue disorder. They share immune system overactivation, autoantibody production, chronic inflammation, and multi-system involvement. It is very common for patients with lupus to also have secondary Sjögren's. So lab test overlap. ANA is positive in lupus and Sjögren. Overlap? Yes. Anti-D double-stranded DNA is positive in lupus, more specific for lupus. It's rare for Sjögren patients to have anti-double-stranded DNA antibody. Anti-Smith antibody is positive in lupus. It's rare for Sjögren. Anti-Rho SSA is also positive in lupus, but more positive so in Sjögren's. Anti-LA called SSB, they are more positive in Sjögren's, rarely or sometimes positive in lupus. Low C3-4, the complement level is low in lupus, but only sometimes low in Sjögren's. Mostly lupus is low. Anti-Rho SSA is a big bridge antibody between the two conditions. So there's a strong overlap. Okay, anti-Rho SSA. Monitoring overlap. For lupus patients, we check CBC, creatinine, urine analysis, urine protein creatinine ratio, anti-double-stranded DNA, complement level C3 and C4. For Sjögren monitoring, we check CBC, ESR, CRP, immunoglobulin levels, kidney function because of risk of interstitial nephritis. Thyroid screening because of autoimmune clustering. So you can see several labs overlap. Treatment overlap, hydroxychloroquine. This is Plaquenil. It's often used in lupus, Sjögren, and overlap disease. It helps with fatigue, joint pain, and skin symptoms, and inflammation modulation. Steroid is used in both conditions during flare-ups. Immunosuppressant, methotrexate, azathioprine, mycophenolate. They are used when organ is involved and there is a severe systemic disease. When they differ, Sjögren is more focused on dry eyes, dry mouth, salivary gland involvement, dental issues. Management may include artificial tears, saliva stimulants like pilocarpine, and dental monitoring. Lupus is more focused on a skin and kidney and CNS involvement and blood clot risk. So it's important clinical point. If someone has both lupus and Sjögren, monitoring becomes kidney focused, blood count focused, antibody trend focused, and symptom guided. Treatment is tailored to organ involvement, not just the diagnosis itself. Big picture, think of lupus and Sjögren as two circles in a Venn diagram. Some features are distinct, some features overlap. And management depends on what is actually actively inflamed. So thank you for watching. If you like the video, please share and repost it. Thank you.